Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about due dates in pregnancy. Now, there has been a lot of confusion that I've seen, anyways, in my comments on TikTok about whether or not your due date is going to change after that first dating ultrasound that you get in the first trimester. So, as per our guidelines, and we use the SOGC guidelines in Canada here, but as per those guidelines, we are not going to be changing the due date for the pregnancy if you have a scan that is over 7 weeks along, and we are going to take that first due date that is done at the first scan that is after 7 weeks, and that will be your due date for the rest of the pregnancy. The most accurate time to date the pregnancy, as in to see how far along you are and to get the most accurate due date, is going to be between the 7 to 10 week mark. After that, the accuracy does end up going down the farther along that you get, but before the 7 week mark, baby is just a little bit too small to again be accurate. So between that 7 to 10 week mark is definitely the sweet spot. But as long as you're in that first trimester still, you're still going to be pretty accurate. So between that 10 to 12 week mark, that's still totally fine. It will still be accurate, just again, not as accurate if you came in between 7 to 10 weeks. Now, the reason why it is more accurate in the first trimester to do a dating ultrasound is the way that we measure baby. Between 7 to 10 weeks, baby is just looking like a little blob on the screen. So we can pretty easily tell where the head is and where the bum is, and there's not much variation in the way that we measure baby. Unfortunately, though, as baby grows and as baby looks more like a baby, like in the second and third trimester, we end up not using just the crown rump length, as in just the length from baby's head to baby's bum, in order to get how far along baby is. We end up combining 5 different measurements and getting an average of them in order to see how far along baby is. This allows for greater variation in the way that ultrasound techs are doing these measurements. So not only is every tech going to do these measurements just slightly different, but also there is just a variability in general when we are doing measurements of 4 different structures to get these 5 different measurements versus just the one crown rump length measurement that we are doing. And again, like we do like 3 crown rump length measurements in the first trimester and get an average of them. But we are still only doing technically the one measurement versus the 5 measurements that we are doing later on in the pregnancy when we are trying to see how far along baby is. So that is why it is always going to be more accurate in that first trimester. This is why your due date shouldn't be changing when you get subsequent scans in the second and third trimester. I've again seen a couple of comments from people saying that their OB ends up changing their due date in the second or third trimester, depending on how baby is measuring. And from what I know, that shouldn't really be a thing because it is not going to be as accurate as when we saw baby in the first trimester. If anything, if let's say at 20 weeks, baby is measuring 22 weeks, it shouldn't be that the due date is then changing to be earlier than what the estimated due date was from the first trimester. This should just give you an indication that baby may be bigger than what is expected, as in you might be having a large baby. That's why it's measuring larger than what the estimated gestational age is at that point. And it shouldn't be to then change the due date to make baby look average at that point. So after the first trimester, we are only really using that due date as a ballpark with how baby should be measuring in terms of growth. And again, just because baby is measuring bigger or smaller in the scans that we do in the second and third trimester, definitely doesn't mean that your due date should be changing. If anything, this is going to just give an indication that baby is either smaller than normal or larger than usual. So I'm not really sure why some of these OBs apparently are changing the due dates for these pregnancies, when in school what we learned was that the due date at the first trimester is going to be the most accurate and therefore it does not change. And when we are doing measurements in the second and third trimester, there will definitely be a due date that the machine calculates based on the measurements that we do. But again, this is just a automatic calculation that it does, and it's not to say that we then change baby's due date to that new one in the second or third trimester after we have done those measurements. So hopefully this video has been helpful in why we are not changing your due date after that first scan in the first trimester. That is going to be giving you the most accurate due date for your pregnancy. It is also worth noting that the farther along that you get in the pregnancy, again, it is just going to be less accurate. When we are estimating calculations as well as due dates, in the first trimester, there is only about a plus or minus 1 week variation on each side. Second trimester, that increases to plus or minus 2 weeks. And in the third trimester, it is plus or minus 3 weeks, or up to a pound on each side that we are estimating for variation. So this is why we are not going to be changing due dates in the second and third trimester, when we could be definitely off by a lot more than when we were just seeing baby in the first trimester. And hopefully this has definitely cleared up some things for you guys with questions about due dates. As usual, if you have found this video informative, please go ahead and like this video, comment on the video, or subscribe to my channel. And also, I make videos on TikTok too, so go ahead and take a look over there as well.